The dire state of patient clinical care at some public health facilities is yet again receiving public attention. This after a video of a patient, Tom London, went viral, relating his experiences and alleged poor conditions at the Helen Joseph Hospital in Johannesburg. London described the atrocious facilities and alleged that the staff treated patients like cockroaches. The Gauteng Department of Health said that they are willing to subject London's clinical treatment to independent evaluation, and also that infrastructure issues at its facilities have no effect on treatment given to patients at the hospital. To talk more on this and the state of our public health facilities, we are joined by the Minister of Health, Dr. Aaron Motsoaledi. Minister, thank you very, very much for your time and welcome to the programme.
Thank you, Leanne. Good morning to you. Good morning to the listeners and viewers out there. And Minister, thank you very much for having me.
It's an absolute pleasure. Thanks for heeding our invitation. So, Minister, obviously this has just prompted a big spotlight to be shone on the public healthcare situation here in South Africa. I don't necessarily want to focus on Mr. London's allegations. I really don't want to talk about his case, because there are tens of thousands, if not millions, of other South Africans that have spoken out against this on a daily basis, and it seems to fall on deaf ears. But Minister, let's get your response to the latest dire patient allegations at Helen Joseph Hospital.
Well, Leanne, it all broke our hearts. It was quite disappointing. But under no conditions are we going to condemn the whole public healthcare system because of what happened in Helen Joseph. Because, Leanne, there are millions of South Africans who have gone through our hospitals and were treated and were sent home. For instance, every year, 1,060,000 pregnant women go through our hospitals and deliver babies, most of which without any incident. So we are not going to sit here and argue that we don't have problems. We do have. That's why we want changes. That's why we want to introduce universal health coverage so that we cover everybody financially. Because at the present moment, we are running a healthcare system whereby there are parallel healthcare systems, whereby one healthcare system is having huge resources for 14% of the population, but 86% of the population don't have those resources. Yeah. And Helen Joseph within that 86%, and that's why we want to change that system.
Yeah. Minister, let me quiz you on that, because South Africa's GDP, about 10% of this goes to the healthcare system. As much as we want to say that there's not enough money within the public healthcare system, a lot of people talk to corruption, poor maintenance, the fact that the attitudes amongst the staff is not good because they are stressed, they are overworked, the facilities are falling apart. And there is not a cause for the fact that there isn't money. There is money going into the hospitals, but it's not going into the hospitals. I shouldn't say that. It's perhaps going into the pockets of a few that are working behind the scenes to corrupt the system. Perhaps you want to respond to that.
Leanne, let me correct a little bit. 10% is just too high. We're not spending 10% of the GDP. We are spending 8.5, which is also very high, because the World Health Organization has stated that if countries spend only 5% of the GDP on health, then all the people in that country ought to experience a good health outcomes, and everything will be better for the population in that particular country. We have far exceeded the 5% recommendation. We are at 8.5%. The problem, Leanne, which everybody is trying their best to run away from, is the fact that 51% of that goes to serve only 14% of the population. And the remaining 49% serves a whooping 86% of the population. Nowhere in the world do we find that state of affairs, that gross inequality. That must be taken into consideration. The issue of corruption, I'm one of the people who fight corruption wherever I am, and you know very well that we don't tolerate it. But I don't think we can use corruption as a reason why poor people in South Africa cannot be served, why we can't fix the healthcare system because there are corrupt people against us. We have done everything. Very recently on medical legal cases, we have called SIU, we are working with them, we have launched the Anti-Corruption Summit. We are open to proposals on how this whole issue of funding of healthcare, the money should be taken care of. We are prepared to bring even people who have got skills outside government.
Yeah.
Having said so, Leanne, please do know that people follow money. If only 14% of the population is enjoying the biggest slice of the healthcare spend at 51%, all the good people who are good managers will go there. The good auditors, the good CAs, the good specialists, they'll all go there and leave the poor with very poor management. I mean, managers, because everybody is going there. So it's the situation that we want South African to sit with us and say, we can't go on with this situation. We can't keep on pointing fingers at each other. We can't keep on having Helen Josephs of this world, and we can't throw our hands in despair in the air. We have got to change this situation.
We certainly
Leanne,
do. But Minister, this is not new. This isn't new. When you go back and you look at articles and people complaining about the healthcare system, this has been for the longest possible time. So I don't think people are throwing up their hands. You've got doctors and nurses that are tirelessly spending their days and nights in these facilities where there's no water, the air conditioning is broken, the bathrooms are in a poor state, that there are no spoons for the patients to eat, that they are freezing in certain cases in their beds, that they are working in institutions that they don't even have medical supplies. And the reality is that we get back to the funding, which is there. It's not good enough, and I'm not. This is not against in terms of having NHI or not having NHI. I think we need access for healthcare for everybody. But the reality is, when it's managed in the way that it has been managed for all of these years, because the maintenance is just not there. Fires at hospitals, patients having to be removed, children being held in cardboard boxes. Patients dying in queues because they are not being attended to or being chased away, getting there at 3 o'clock in the morning and having to leave at 4, not being seen to. These are the stories that I am reading right now of South Africans when they encounter the healthcare system, that it's not acceptable, Minister.
Leanne, you are reading all the negative stories, yes.
I have to focus on the negatives because I
Yes.
cannot compliment you and I cannot focus on the positives because I'm not here to give you a pat on the back for doing a good job. I'm here to hold you accountable for what you're not doing. And this is where I'm saying it's not working. Yes, it works for millions, but it also doesn't work for millions.
Leanne, do you want to continue this interview by speaking alone?
No, please,
and
carry
say
on.
You are holding me accountable. No,
Please.
You are speaking alone all the time. The moment I open my mouth, you come in and say, but.
Not at all.
And
Minister, please answer. Please go for it. I'm giving you the time. Please, Minister.
Thank you very much. You are going only for the extremes, Leanne. I'm telling you, the public healthcare system every year is treating 80%, 86% of the population, which are millions of people. You are right, those don't appear in the media because the media only put those ones which are negative, the positive ones where they have faced the experience. You said it's not your job to put them out for people. You are holding us accountable. For instance, you're speaking as if we don't have any hospital plan or maintenance program. We do have. There are many new hospitals that are built in South Africa, and I'm promising you, I'm going to give you the list of all the infrastructural problems in our country, and there are many of them, and we're trying our best. But time and again, we do have find Helen Josephs of this world, which breaks our heart, obviously. But I am saying because of what happened in Helen Joseph and many other areas where something went wrong, we should not throw our hands in the air in despair. We are busy trying to fix the system, and the issue of universal health coverage, which you say you support, but you put a big but, and that but is saying it should not happen because there are people who cannot manage. But I am telling you, we want to equalize the system so that we get good managers on both sides of the systems. And I'm telling you, the other 14%, which is managed very well, is because it has got huge amounts of resources. And I don't understand why you run away from that and say, but mismanagement and corruption. Yes, it happens because there are no good managers, because all the good managers will run where the resources are. And that's why we want to equalize the resources. But I want to give you a list of all the hospitals that are being built. I can only remember 4 off my head, big ones. We are building an academic hospital in Limpopo. It is busy under construction. In Mpumalanga, they are building 2 brand new big hospitals, one in Bushbuck Ridge to replace the hospitals in which I worked in 1985. One is being built in Middelburg. In Limpopo, apart from the academic hospital, we are rebuilding Siloam hospitals, and I can give you a list of many more all over the country, clinics and hospitals that are being built. 40% of all the clinics in the country, 40% of all the clinics in the country were built during the era of democracy. The other 60% were built from 1994 backwards up to 1652. So it's not that there's nothing happening, simply because here and there we still find big problems.
Yeah.
Leanne, I've gone through worse things than what we are going through now.
Yeah.
I was the first MEC for health, for education in Limpopo, where lots of kids were under trees and in dilapidated structures. We sat down and started building them exponentially, and we never threw our hands in the air. We built them. The situation is much, much better than when it was in 1994 in most of our schools.
Okay.
In 1986, yes. So we are going through a situation which some of which we have seen before, but it does not mean that there are no plans to improve it.
Yeah. So, Minister, thank you for responding and certainly talking to us about what's being built, what's being done to help with inside. And we know that there is work being done inside, but we have to highlight what isn't working. And one of the big complaints, and I must say, through all of the comments that we are receiving and the feedback that's being given, one of the big issues, and I think perhaps maybe you need to address this, is the attitude of doctors and nurses within these institutions, because that seems to be a very big concern for people as well. Is it perhaps because they are overworked, that the system is too busy, that there is just too much going on? Or what is the case? Because many, people talk to the oath that doctors take and that the treatment that they are giving the patients is not right. Now, how do we fix this? Because at the end of the day, being in the medical system is facing patients all day long. And when you are not treated well, this is the worst thing for human dignity.
Well, the people you are speaking about have taken an oath of office. And among the things they've promised is how to handle patients with empathy. But in order to make sure that we supervise that, we have established the Office of Health Standard Compliance to make sure that hospitals and facilities comply with standards. We also have institutions like the Health Professions Council of South Africa, the Nursing Council. We even established the UMBAT office. If you remember, Leanne, I am the one who established the office of the first ever health UMBAT in South Africa. And people ask me, what is this UMBAT? What does it do? I said it's a public protector of health. Somebody who's going to try and protect the public, like the public protector. And that's why we appointed Professor Malra Purumakova as the first health UMBAT. And you know his work. You've seen what he has done, starting with Life is the Main. Now, in Helen Joseph, I am writing a letter to the present UMBAT, because if it's true that doctors acted the way they did, then that's unacceptable, because they took oath. During our time, Leanne, we were more overworked than ever. I know that people get angry when you say this, but I'm telling the truth. You can go and check. Yeah. I have run some hospitals, being one. I ran many hospitals in Limpopo where you are working alone, even doing a CSA alone, which is against the rules, but simply because you want to save somebody who is about to die. We have done that before, so we know people are overworked, but that's not an excuse of being rude to patients. Yeah. Lastly, Leanne, it's very funny. Quite a number of our health workers, both nurses and doctors, do work in both sectors. We have got a lot of nurses who do what is called moonlighting, going to work in private hospitals, where they work very, very well and smile all the time and the following day they are tired, they go to the public hospitals and they meet poor people. It looks like when professionals work among poor people, they change their attitude, unfortunately. And that's one of the things that we are going to fix through the Office of Health Standard Compliance, through the UMBAT. As we're speaking now, I'm here in Magalis. We're spending the whole week here. Yesterday, we brought the CEO of the Office of Health Standard Compliance to show all the MECs of the country, they're all here, to show them what they found when they inspect hospitals, where the weaknesses are, what needs to happen, where are the problems. They showed them pictures, some of which, of course, are like Helen Joseph, but they also showed pictures of the good areas, which, of course, you won't show on TV because you said you only want to show the bad ones. But the Office of Health Standard Compliance was showing and saying, here you have passed 100%, here you have failed, here you get 0, here you get 50%. So we are definitely doing something about it.
All right. Minister, we have to leave it there. And it's so hard to cover the good and the bad and everything around the healthcare in just a couple of minutes, because it's a long, protracted discussion that needs to be held. But we thank you. We thank you for being with us, for allowing yourself to answer these questions and answering them for us. That is the Minister of Health, Dr. Aaron Motsoaledi, talking to us about the state of our public hospitals and allegations of patient ill treatment labelled against some health workers. And certainly we do hope that, Minister, you'll be with us as we investigate more, and perhaps we can go with you into one of these hospitals where all these allegations lie, and we can get to the bottom of this. So that's a plea we'll give. Some of the comments that have been coming through, we will read them. It is hard to read what people are going through on a daily basis, but we'll certainly bring them to you and try and shine a light on what is happening in the public healthcare system.